Have you been given this exercise to manage your low back pain? It might actually make it feel worse. Have you been dealing with pain here or here? This is an exercise video you're going to want to watch because we're going to progress that exercise into something that's more usable. This is Don and I'm Sebastian, and we are the locally world famous chiropractors, two parts, in Costa Mesa, California, and we're going to get right into the exercise video now.
Absolutely. So show me the exercise that everyone's doing right now. Yep, so it's kind of a pulling the knee into the chest. I think the idea behind this one is a decompression of the low back and the spine in this. You may notice that it starts to loosen up the more that we're doing this one, but it usually is temporary relief, right? So what we're going to do is create more of a challenge in this same biomechanical position, but maybe gives you longer lasting relief. I want you to bring both knees to your chest. Good, and pull in. I want you to make sure that this is safe for you first, okay? So make sure that this feels okay to begin with. And then without your hands, I want you to try to keep yourself here. Beautiful. What do you feel working?
I feel my hip flexors a little bit.
Okay, so if we feel hip flexors in this one, it kind of happens a lot with people, but what we're going to do is I'm going to have you lift your head up off the ground and find a little crunch. Good. $100 bill here on your knee. Hold on to it. Don't let anybody take it from you. So if I were to try to come in here, we can't. So he's trying to push his knee in the opposite direction here, and he's trying to read the fine print on the $100 bill there. If you guys can see, I don't know if you can, he's shaking a little bit, and then relax there. Come out of that. Perfect. So we'll go through this in steps again. Knees to chest, holds, curl up, read the $100 bill, press on it so no one can steal it from you, and breathe in through the nose, out through the mouth until you feel like you just hate me for doing this exercise because your belly is working harder on you.
The belly's working harder.
Okay. So what if someone is feeling like their hamstrings are pulling in this one?
Yeah, so that's a good question. So first off, we need to make sure that this is the right exercise for you, because if this bothers you, then this might not be the right exercise for you, because then you might be dealing with what we call a flexion intolerant back. It doesn't like flexion, and the exercise is in flexion as well as the exercise that you were given. So, but if that's not the case, maybe something that we want to do is to create a little bit of pressure through the fingers, and usually I like to regress people a little bit more first before we actually do the exercise that Don suggested. And that's going to be putting the thumbs right into here, and you breathe with your guts into your fingers. It sounds silly to say, and some people say, oh, you're talking about Halloween. No, I'm not. I'm talking about pushing with your guts into your fingers, still being able to have enough breathing capacity. Like, it shouldn't feel like you're like that, or sucking your belly button to your spine. So that's one thing. If you're curious more about the flexion intolerant back, we have a webinar, or a learning tool, sorry, that's over there. And it covers a lot of the different reasons for low back pain, either flexion intolerant backs or extension intolerant backs, and a lot of different diagnoses as well. And so please take advantage of that. It is a learning tool that will be really helpful to you as you move forward, especially if something like this works for you today.
Absolutely. So in this exercise, if it is feeling like maybe this is headed down the right path for you and you're responding okay to it, I want you to do it to a challenging amount, not all in one set, but maybe do 5 to 10 second holds with some breathing until you feel that belly working. Once you feel like you just can't do it anymore, do it one more time, and then retest afterwards and see how you're feeling. This is not a no pain, no gain exercise. You shouldn't feel your back in this at all. It's decompression, belly wall work, and feeling wonderful afterwards with a little bit longer effects.
Yep. If you guys want help refining some of your exercises that you're already doing or stretches that you're already doing, as you can see, we can do something like this, where we take an exercise that's really not working for you or not challenging, and you turn it into something that actually really works, and your body will help. It will help your body adapt, because the whole point is we need to get the body to adapt. So your pain stays away. It doesn't just go away, but it actually stays away because you built a resilient body that can tolerate the work that you throw at it over time. So yeah, if you guys are looking to reach out to us, we have all of our links and contacts at the bottom in the description where everything's at. And just subscribe to the channel, like the video if you can. We have a lot more coming out like this. We'll see you guys next time.